And hello there, Yo.
Hello, Georgie. Thank you for having me.
Yeah, well, we've spoken a bit recently, haven't we?
We've been talking a lot. Yes. Yes, we have.
Which is great because there's so much overlap with our work, and
There
we're
is.
doing a similar thing. But your focus is on dizziness, ours is on pain. So what we'll do is we'll give people a chance to join, and then we'll start getting them to leave some comments and things, and tell us who's here and where are they from.
Sure.
But to begin with, excuse me, apart from the fact we were just talking about cold water swimming. So this is the sort of subjects that we get into.
This is no wonder we get along so well, right?
Yeah.
We were just giggling about getting into buckets of ice. So
yes, and why we do it, but then
Yeah.
the benefits that we feel for doing that. Yeah,
Sure.
Absolutely.
Yeah.
Well, we've got people joining us now. So hello everybody.
Hello.
To leave, maybe put a comment in. It's always nice to see, isn't it? Who's there and where they are. Excellent. Hi there, Emily.
Hi, Emily.
That's really good. It'd be interesting to see whereabouts you are. Obviously, more of your followers presumably will be in America, and some of ours will be in the UK, but then there'll be a merging.
There's a great merging. Yes.
Yeah,
what's been interesting, Georgie, is that when I started my channel, I don't, the mysterious algorithms of YouTube, who knows? But I actually, there's always been a very big chunk of my audience that's from the UK. And I don't know, again, I don't know why, but I suspect someone early on was from the UK, and then YouTube said, oh, okay, people from the UK must be interested in her work, and started showing me people in the UK.
So. And I'm always interested about sales of my book as well, because sometimes there's loads in America. More recently, there's been loads in Italy. I think, wow, how come my books? How did they find that?
Yes. Yes. Speaking of ice, I've suddenly had a surge of people from Finland.
Oh, really?
Yes. I don't know what that is, but I guess the point is, and really what should be making us feel good. Clearly, this is a worldwide problem. This is not just limited to certain countries. So I'm always so glad when people do find me from countries where there aren't as,
Yeah, absolutely. Well, hello everybody so far. I can see Pippa's here as well.
Yes, hi Pippa.
Janice, talking about being in the UK as Pippa is, but working with you, which is great.
Yes, hi Pippa.
So I think we'll have a load of people who know about you anyway. Your followers, plus we've talked about you recently on our social media as well. We know you're an audiologist and that you started getting into the mind body field. Yes. So how about we start there and just how did you get into the mind body field?
Wow. So do we want the elevator speech, or do you want the long story with all, the drama and maybe the elevator speech?
You could have the elevator with a little bit of drama.
Okay, elevator with a little bit of drama. Got it. Okay. Yeah. So, long story short, I worked as an audiologist in several different normal audiology settings, and I was just incredibly frustrated, and I burned out and developed my own mind-body symptoms, quit in a blaze of glory. Well, I like to think of it that way. There's the drama, but it really wasn't as dramatic as I just made it sound. It was more of a, okay, I'm not going to do this anymore now. But I quit in what I now refer to as a blaze of glory, and said I was never going to do anything audiology related again, because really what it came down to, Georgie, I think you probably identify with this very much, but I didn't become an audiologist to stamp diagnoses on people's heads and then sell them things, or like hearing aids, or send them back to a provider with a diagnosis that wasn't going to actually help them in any way. So I speak for my fellow audiologists. I know people become audiologists, people become physical therapists, people become medical doctors to help people.
Yes, absolutely.
And there's really nothing more soul sucking than feeling like you spent all this time and effort, and it's just not, you just, those particular patients tend to haunt you, the ones that come in and you're just like, what was going on there? And I had no idea how to help this person. And it became so frustrating to me.
So the same for me, physio with chronic pain,
Yes.
Why can we only help manage them? There must be more we can do for them.
Exactly. Yeah, exactly. So yeah, then I had my own mind-body disorders, kind of went through a little bit of an identity crisis too. Something also that our viewers here may be familiar with, because some of them go through identity crises because of symptoms, because suddenly they can't do the things that they were doing before. And their whole lives, they had seen themselves as being a particular person with a particular role. And then that role changes, and it can be really destabilizing.
Absolutely.
So in that time, a few things happened that just kind of serendipitously led me to discover my own mind-body journey was actually a mind-body issue and not actually something else. My mom developed a vestibular disorder. I started getting really into this. I mean, I started doing a lot of extra training in vestibular rehab because of this interest I had that, again, was really sparked by my mom. And it just kind of snowballed. And once I started reading one thing, it all kind of clicked. And then I wanted to read something else. And then I would talk to someone else. And then in the meantime, while I was learning, clients started finding me. I was working as a contractor at this point at a neurologist clinic and a physical therapy clinic. And it was kind of a strange twist of fate. People with PPPD, MDDS, vestibular migraine, these chronic dizziness diagnoses that don't have medical treatments that are adequate. They started to find me. They were my first guinea pigs, really. And the more I worked with them, the more I realized I needed to know more. And the more I realized that a lot of the things that we talk about for chronic pain are both applicable to chronic dizziness and kind of need their own chronic dizziness tilt and if we're going to be effective with them. So that's how it started.
Fabulous. Right. And then you've done some of the training in this field as well. And you've just sort of gone woof. So many of us specialize in chronic pain, and yes, we include other symptoms, but you specifically as an audiologist decided to specialize in dizziness. So it's fabulous that you've developed all these resources. So you have your YouTube channel, and we'll include all this at the end anyway. This on. So you have your own YouTube channel with loads of interviews you've done with various people, including myself recently, and you have free resources on your website. You've got a free.
I have a free course.
So fabulous. So there's so much out there to help people.
Well, so what ended up happening was I was working with these clients, and I found myself needing to repeat myself a lot because they were feeling terrible and they needed me to repeat myself a lot. And I said, I'm going to make you a video, and then you can just play it over again and I won't have to say it again. So I started making my YouTube videos thinking no one would ever watch them except for my own clients. And then it kind of caught on, not like, in not wildfire in the like actual like viral video sense, but in the vestibular world viral, right? Because the vestibular world is small. And what struck me first, I mean, I think I only had a few hundred followers at this point. What struck me, there were already more people than I could ever help. And many of them lived in countries in which they just didn't have access to resources, either economic or they had the financial means, but they didn't have anyone to go to. So that's when I made the free course. So it was really early, very early on in the YouTube channel that I made the course, and I update it every year. So it's always updated with some of my latest thoughts and techniques and learnings from my work.
Because things change, things evolve, don't they? There's so much evolving. We're learning so much more all the time, and it's about keeping up to date with everything. And so I think this is great because you are giving hope to people. And as was it Emily saying that your recovery stories on YouTube gave her hope. These recovery stories are really important, and to have something specifically about dizziness, people like to know that their condition is. We're talking about their condition, or that they see somebody else recovering with their condition. And we know that it's very similar, the same sort of the approach for whatever symptoms there are. But it's really nice for people to feel like they're not different, because quite often that is a stalling point, isn't it? When people say, but I'm different.
Totally. Yes. Although Georgie, I still to this day have never met someone who didn't say I'm different, even if they have exactly the same symptoms.
Yeah, that's true.
But to your point, there's a reason for that. I mean, what this really comes down to at the very kind of at the core of it, right, is people have this nervous system dysfunction in which their nervous system doesn't feel safe. That's what the stress, all these other terms that we use to describe it, it really comes down to a nervous system that's not feeling safe. Yeah. So when people are told, well, just read that book and replace the word pain with dizziness, it leaves room for more doubt and more uncertainty, and it makes them feel less safe. So to me, it's just so incredibly essential. Whether someone works with someone who's a dizziness specialist or not is actually irrelevant, but that we need to use dizziness specific language for people who are dealing with dizziness specific symptoms.
Yeah, absolutely. And as Michael says, your videos are a lifeline for him as well.
Oh, Mike. Hi, Mike. I know Mike. Hello. Thank you. Thank you.
So why, you asked me when we chatted how the stress cause chronic pain. So I'm going to turn that back to you. And why do you feel people develop dizziness? And we'll come into maybe asking you more about the sort of diagnoses, because I know people would like to know that as well.
Sure. Yeah.
Why do you feel people might specifically develop dizziness rather
than pain? So a couple different ways to think about this. And I tend to take a very I wouldn't say like necessarily scientific approach, because in some cases there's just really not enough research in the vestibular field to back me up. But I like to take a very practical approach to this. So rather than, I know some people really relate to this idea, like vertigo's brought on because I was spinning out of control. If you resonate with that, wonderful. But I like to think that different people have different biological vulnerabilities to one symptom or another. And it doesn't have to have a meaning. I can say that it does seem that different people have different tendencies toward one type of symptom versus another. For me, it is back pain and migraines. If I am stressed, if I'm not taking care of myself, that's how my body talks to me. And for other people, it's dizziness. So I don't know that there's a deeper message behind why someone has dizziness. What I do know is that someone who's had some kind of vestibular injury before, maybe 20 years ago, had an inner ear infection or something like that, the body does tend to remember those kinds of symptoms and can reactivate them more easily once they've been around. Does that answer your question?
She used to get motion sickness as a child.
Yes.
And I think, very much. These things meant the neural circuits are there and they could be more easily triggered as well.
Exactly. And my heart goes out to people who have dizziness, because I look at it as someone who has had chronic pain. So I say this with complete empathy for everyone going through any kind of mind-body symptom. Dizziness just has a particular way of making people, gosh, I mean, what other word do you use? It just feels so completely disoriented and groundless. And again, not to say any other symptom doesn't have its own awful effects, but I've told people this. You may not know this, Georgie. I don't know why I even know this, but apparently one of the first sensory systems that we develop when we're developing in utero is the vestibular system. And if you think about it, what is the most fundamental capability that an organism needs to have in order to survive? So, I mean, if we're thinking about an amoeba, before food, you need to be able to move. You need to be able to know where you are in space. You need to be able to get away from predators. You need to be able to move toward sources of food. Absolutely. So orientation, balance, those things are just foundational, and your brain does not respond well when you don't know where you're oriented. So it's really no wonder why people feel so awful when they have that particular symptom.
Yeah. And I know I said to you last time when we had a chat that I had one short episode of complete dizziness where I had to hold, even sitting up, I had to hold the arms of the chairs to keep upright. So luckily, a short experience, and I was able to use the somatic work to just sort of emotional awareness, to just really pause, breathe, feel, and then reassure myself, and it did calm down. And I think that's the other thing, is about recognizing that, I know we both agree with this, that this is a personal development journey. This is not about get rid of the pain, is it? This is really about looking at, if we just resolve the pain, like read a book and resolve the pain, and we don't change anything in our lives, don't transition in some way, and look at maybe the beliefs and the behaviors or whatever, then the chances are we are going to have a symptom again. So this is really about developing a felt sense, becoming more aware of how we're feeling, looking at our personality traits, or whatever way we create self-induced stress. And it isn't just about, okay, let's get rid of that symptom and let's carry on with the way we've been living.
Oh, I could not agree more. I mean, and I tell people, I'm not going to judge people who are able to approach it that way. I always,
if you can,
right?
But they'll learn at some point.
Right. Exactly. And to me, it's a lost opportunity. I mean, if you're feeling this bad, we may as well address some of these other things that have been making your life not as great. And, that reminds me, Georgie, of something that came up yesterday in my community. We were having a discussion about grief and how you have to go through the grieving process in order to make room for the new person. And I think this can be really tricky for people as well, because they'll hear you say something like, you're going to need to, or they'll hear me say this, because I get very blunt about this. You're going to need to change in order to get better. And they're like, I liked who I was before. Do I need to get rid of like all of the good characteristics that I had before? And of course, the answer to that is no. But the truth is that there is a loss there. There is a loss of who you used to be, and it's okay to grieve that. In fact, grieving that is a necessary step to being able to move forward.
Yeah, absolutely. Absolutely. And then going back to this connection of, if we've had symptoms before, that the brain learns it and nervous system learns it. And Emily says, actually it was Pippa, I think my brain learnt dizziness after ear surgery and brought it back when I was under a lot of stress. Absolutely. Exactly. Yeah. And Emily says that she's been able to ignore so many illnesses and symptoms in her life, powered on through. First symptoms I couldn't power through was dizziness. So dizziness is one of those things, if you think of the symptoms as actually just saying, stop, enough's enough. And in fact, the more severe the symptom, the more you need to just stop whatever you're doing. And what does dizziness do? But it makes you stop, because you just can't move forward.
You can't. Exactly. Exactly.
You have to lie down often.
Exactly. And I would never wish it on a single person. Yeah. So this is not coming from me saying, well, you should be happy it happened. There's no, I would never wish this on a human being ever. But I think this is why, Georgie, when I do all those success stories, I had a goal of doing at least one success story a month this year, and I met it. I have 23 now, and more coming. I already have like 4 more scheduled. Right. One of the common themes that emerges is, nothing else would have made me make these changes in my life. And how can I not be grateful for that happening? Which, again, may not resonate with someone who's new to the symptoms. And I totally respect that, but I do hear that from people as they get better.
Yeah. Very often, definitely. In fact, I had an email just this week from somebody I worked with, actually, I don't know how long ago, a good few years ago. And every couple of years she'll email and just say, thank you so much. My life is so different. I've changed. She's changed a lot, but it's opened up her life for her to be able to do more than she did before. And it's wonderful, isn't it? Getting emails like that reinforce why we're doing this, despite the challenges, of actually doing this.
Yes, it can be. And I know you've taken a lot of heat. And you, so when I take heat, I remember that you're out there, and the Dr. Schubiner is out there. I know, gosh, the heat he's taken from people. And I say, if they're doing it, I know them. They're good people. They have all the best intentions. I know that they're right. I can't just fold when I take heat for these kinds of views. But there is some controversy around it.
There is, but I think now there's so many more of us doing this work as well. And in fact, we had a CPD weekend, or what do you call them in America? This continual professional development.
Continuing ed.
Yeah. Right. Yeah. So all our membership, so our practitioners, we had a weekend away where we did CPD. So we did some learnings, seminars throughout the weekend. We also had self-care sessions. So we had a session where one of our practitioners took all of us through a mindfulness session or a meditation session, a laughter therapy session. That was incredible. And we all just connected. And I think the biggest takeaway from the whole weekend was how important it is for peer support and for connection to get to know each other, to feel safe in our community, because you can be very isolated working in this field. And then we're not just talking to practitioners here, and I think that's the important thing, is we have such a good, large global community now that we can actually support each other, which is fabulous. So if any of us are struggling, we need to reach out and ask for support. And that can be just as challenging for practitioners as it is for anybody else.
Oh yeah, there's a reason we end up in this field because we tend to share many characteristics with those same people who end up with the symptoms you were working with right now.
Yeah, and we're caregivers. So
yes, yeah. Anyway, it takes one to know one. Yes.
Yeah, absolutely. Yeah. So anyway, if anybody has any questions they want to pop in there for Yo, please do. And in the meantime, or Dr. Yo, I should call you here, what I know people will be thinking, like we were saying before, yes, but mine's different. What are the sort of dizziness conditions? What are the labels that people are given? Because just dizziness covers a whole range of different diagnoses, doesn't it, or labels?
It does. Yeah.
What are pretty common ones that are
neural circuit issues, or stress illnesses? Yeah. So this is I think in the United States is probably much more commonly diagnosed, but I'm seeing, again, global community now. So I see people from all over the world who are getting this diagnosis. The most common one is PPPD, persistent postural perceptual disorder, which, Georgie, basically means you've had unexplained dizziness most days and it's causing you distress and we don't know why. That's basically what it means. So it can encompass a very wide range of symptoms. That one, vestibular migraine, that's another one. The diagnostic criteria are a little different, but honestly, I hate to say this. I'm not in any way implying that practitioners are making mistakes here, but the label you get really depends more on what type of doctor you see than on what you actually have. Because when it's medically unexplained, all they're trying to do is say, well, these symptoms kind of like she has these symptoms, or he has these symptoms on this list. Okay, well, more on this list. So we'll go with that label. Yes. When there's no tissue damage, you're just basically making a call based on what the person's telling you, which isn't an exact science. So vestibular migraine, and then MDDS, mal de Debarquement syndrome is.
You want to say that more slowly, please?
Sure. Mal de Debarquement. And I'm so sorry to our French listeners for my horrible French pronunciation there. But MDDS. So that one is sometimes thought to be brought on by passive motion. So classically, you'd get on a boat and then you'd come off and you'd have rocking after you get off a boat, which, by the way, is normal. Everyone, I mean, about 80% of people have that symptom after getting off a boat. But I'm seeing it diagnosed now in situations in which it doesn't make sense. So I'm seeing it, people get MDDS diagnoses when they got off a plane, which doesn't make sense from a vestibular perspective. Or now there's a whole category of people who are diagnosed with spontaneous MDDS, meaning they have those same symptoms of this rocking, bobbing, or swaying, but just no cause. Yeah. So, which of course to you and me, I mean, is very clearly, okay, so this really seems like it's high suspicion here for a mind body or a stress illness disorder, but unfortunately it's really not being treated as such. People are being specifically told for all three of these conditions that there's no cure, that they're chronic, that there are treatments, but especially for MDDS, that there really isn't a cure or treatment that works.
It's scary for an individual.
It's really scary. Yeah.
Talk about lack of hope.
Yeah. Yeah. Oh, absolutely. Yeah. 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 It's really, there's a little bit more headway being made for people with PPPD than some of these others, because at least with PPPD, people are generally told there's something that can be done. They're not using, as far as I'm concerned, the appropriate techniques, but they are at least saying there's something that can be done. Whereas for the others, they're really not. I mean, especially for PDS, but also for vestibular migraine, they're told this is a chronic condition you're going to have to live with the rest of your life, and here's the medicine. Yeah.
So another common diagnosis is Meniere disease. Where does that fit in?
Oh, tricky one. So, okay, let's see if I can make this very succinct. So Meniere's is truly a tissue damage condition when it's Meniere's. Okay. And that is
when it's diagnosed,
when it's actually Meniere's. So the problem is, so I am not denying the existence of Meniere's. There is actual Meniere's out there, but I have personally worked with many people who've made their way through the community or my YouTube comments or clients who got a Meniere's diagnosis and had absolutely no clinical signs of Meniere's. They were just given the diagnosis because they saw a physician who said, chronic medically unexplained dizziness, and maybe there's some spinning sometimes. Okay, sounds like Meniere's, which is not an indication that someone has Meniere's. That could very easily be a mind body or stress illness type of dizziness. So when Meniere's is actually present, it causes tissue damage that leads to symptoms, but it doesn't cause 24/7 symptoms, and it shouldn't be causing symptoms in between these particular attacks. Furthermore, there's research that indicates that Meniere's disease attacks are very highly influenced by stress. This research was done in the 90s and it was dropped, and now people are denying that it's true. And it shocks me when I see this kind of stuff being said, because the science on pretty much everything else is so clear. We have never had such good evidence that the way our bodies function is highly influenced by our psychology and our social state. And there's so much more research about this now. So to me, to now say, well, that applies to everything else, but not Meniere's, is just, it's just ridiculous. So the first thing I would suggest if someone has a Meniere's diagnosis is to make sure they actually have Meniere's. If the doctor just gave you the diagnosis based on symptoms, it's very possible you don't have it. If you actually have documented tissue damage in your ear, the severity, frequency of attacks is stress modulated. It can be highly influenced by internal and external stressors, just like people with pure neural circuit dizziness or stress illness, pure stress illness dizziness. So the work is just as beneficial for you, and it's going to also help with any symptoms that occur in between, if that makes sense to you.
Yeah, absolutely. And I think it's similar to these chronic pain conditions as well. For example, somebody going to a physio or a doctor and being told, oh yes, you've obviously got a prolapsed disc or a slipped disc, without actually doing a scan. Let alone the fact that most of us do as we get older anyway. And as Pip has just said, GPs used to often tell people they have Meniere's in the UK without an ENT opinion. And this is the problem when people are being told this is someone in a white coat or a therapist, and they take that as gospel, whereas actually that's just looking at the symptoms and considering, okay, then you've probably got this. And that also explains why I've had a number of people with a diagnosis of Meniere's disease who recovered completely. And they probably didn't have a proper diagnosis anyway. I wasn't treating for that specifically, but they had that diagnosis as well.
Yes. And I think I always tell people, you're allowed to have doubts. It's worth a shot. What are we telling you to do? We're telling you to be nice to yourself. Stop treating yourself like a jerk. We're telling you to maybe take a little more care of yourself and set boundaries or whatever else it is. That essentially that's what we're saying.
Feel safe.
Right? Feel safe. So to me, it seems like the techniques we talk about, I'm aware we're doing this, of course, you and I, for the purpose of helping people with symptoms, but really everyone should be doing the things that we talk about. Really, everyone should. So what do you have? Really?
Absolutely. Right? And rather than sort of trying to find an answer and research everything and find out, why not sort of go with the flow, which I know is hard when there's fear related, but deal with the fears, and then actually just follow this anyway, because it can only help.
Right.
Should we go on to some of the questions that have come in?
Yeah, I saw one from Emily up there.
Yes, Emily's saying, PPD diagnosis. My dizziness and vision issues have much improved over months, but now I have very weak legs and head pressure. Can weak legs and head pressure be dizziness related?
Oh,
not necessarily just a dizziness.
Oh, yes, 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 yes. So there are, again, kind of multiple ways to think about this, but I love being able to give people very concrete vestibular explanations for things sometimes, because I think that really helps put things in perspective and not make them so scary. Mm-hmm. So Emily, hi. So Emily, I think you said you've watched some of my videos, so you can probably repeat verbatim what I'm about to say, so please forgive me. But the balance system utilizes information from 3 senses. So unlike with pain, where it's mainly your sense of touch, with dizziness, your balance system is utilizing information from your eyes, ears, and sense of touch. So there's a lot of information for your brain to sort through, which means that when your brain's having trouble with coordinating balance related senses, you can end up with symptoms related to any or all 3 of those sensory systems. So weak legs and head pressure, those are things also related to sensory systems that are associated with the balance system as well. And I'm sure, Georgie, you may have your own name for this. Excuse me, I'm going to just cough off the mic. You're welcome. Not cough in your ear. The name that I have for these symptoms shifting around is symptom drift. And so in mind-body syndrome in general, or stress illness syndromes in general, we know it is very common for symptoms to move around. Mm-hmm. But for people with dizziness, it is so easy for your brain to just kind of pick a different dizziness related symptom to go to. It's harder to create a brand new neural circuit around, leg pain. But leg heaviness, when your sense of touch that coordinates your walking and your balance directly relates to your balance system, it's very easy for your brain to switch modes and start using that as a symptom. Yes.
I think that's a really, really helpful explanation there. Mm-hmm. Thank you.
Yeah.
Okay, so, and as Janice said, she had weak legs and it's gone now. Yeah. Okay, so let's go to Fiona, who says she's had headaches, neck pain, upper back pain, anxiety and dizziness, severe dizziness for 2.5 years. She's still struggling to believe it's not dangerous, despite having a clear brain scan and full vestibular testing 2 years ago. It definitely worsens with stress. I have anxiety, headaches and neck pain. I feel the anxiety triggered the dizziness, but now the dizziness is causing me anxiety and she feels stuck. And Scott's saying that it's similar for him.
Yeah.
So,
yeah.
I'll hand it over to you.
Yeah. Yeah. I'm sorry to hear you're going through this. It is not for the faint of heart. And it goes back to what I was saying earlier. So can I just say, this is not your fault and you're not just being anxious. Okay. So as we talked about before, the vestibular system and the fight or flight system are hardwired together in your brain. Your brain, if you are not balanced, your brain is going to go into a cycle of anxiety. So we're in a way, first of all, you're already way ahead by understanding the anxiety is kind of stuck in this cycle, but trying to just fight the anxiety is going to be a losing battle, because these 2 things are so closely intertwined biologically. So, so kind of to Scott's question, how to get out of it. So there ultimately, what doesn't work is is looking at the anxiety as this thing that you need to abolish. And I know that's tricky, because if you know anything about Georgie's work, if you know anything about Serpa's work, you know that the anxiety is feeding into this big fear cycle, and we need to address that. We need to address that fear cycle in order to make the symptoms stop. But what I like to do is to take people's focus off of the anxiety and the symptoms and help them figure out what else might be feeding into that. Because the dizziness is going to feed the anxiety. You can't stop that. But what you can do is look at what other factors in your life might be leading your brain to be more hypersensitive. And I have never found someone who didn't have other factors in their lives that were making them feel hypersensitive. Yeah. And Scott, the first place that I advise looking, and Fiona, it sounds like you are well on your way to looking in the right places here. What I like looking at is when people respond to their symptoms, they tend to end up with stories. And I get really interested in what those stories are. So, for example, people with dizziness will often, will be stuck in that anxiety and dizziness cycle. And I'll say, okay, so you're stuck in that anxiety and dizziness cycle. And if you don't get better, then they start telling me the story of what happens when they don't get better. They have all these beliefs about what it means about them as a person, about what it means about their future, about their value as a human being, about what they should and shouldn't be doing. And I pay really close attention to what those things are, because those are the emotional learnings that someone has from their past that's putting all this extra pressure on them right now. Again, anxiety is inevitable when you have dizziness. It's not something that you should try to force yourself to control, although there are some things we can do to bring it down. What you want to look at is what else is feeding it. And again, those things, the story you tell yourself, is a huge clue about what those things might be.
Great. Yeah. Excuse me. Yeah, absolutely. And I think it's helpful to understand that. I'm presuming, Fiona, you're talking about Jim Prusak. He's the only Jim I know, and he's great.
Yeah, he's lovely. He's lovely.
But it's about understanding the stories. What if they don't get better, and what if they did? Because sometimes that is also,
that's another one.
Mm-hmm. If you do get better, what do you have to face?
That's another good one. Yeah.
Relevant.
Yeah, totally.
And then people say that it was triggered by PTSD, and Emily says it was started after an acute vertigo from antibiotics. Yeah. And again, I'll be considering, why were you specifically triggered at that point by the antibiotics? Because there's a lot of, past stuff which is affecting your system at that point as well. So, Michael, how can we get more medical doctors who work at disability insurance companies to be educated in mind body? It was so incredibly frustrating and invalidating to have my work disability insurance denied because their medical doctors dismissed my doctor's PPPD diagnosis, and lawyers seem more clueless on mind body. This is my experience anyhow.
This is such a complicated problem. Yeah. So and here's why it's such a complicated problem. It's not just the medical system.
No.
In Western culture in general, there's more emphasis placed on physical harm and physical symptoms, physical disability, than there is on mental. And I'm not saying you have mental illness, but on anything that is not visible. So, for example, and I'm going to give some slightly morbid examples here, but let's just say you hit a person with a hammer and you damage that person's hand. That person can sue you, and it's going to be very obvious. You have all these medical bills. Clearly, the hammer caused the problem. That's how our legal system is biased. If a person said something mean to you and sent you on a spiral in that same moment, that caused just as much harm to you as if they had actually hit you with a hammer, you're going to have a much harder time presenting that case. Again, that's the way Western culture thinks of these things. So it's more than just a medical system problem. We tend to view the mind and the body as two separate systems and not the same system. So, Mike, I think I have good news for you, because I think the research that's going on right now in the field of psychoneuroimmunology, which is that field of study I referenced earlier, where we're showing that people's psychological state and well-being have a direct impact on their physical well-being. As that research develops, I think this is going to have to change, because the science is going to become so overwhelming that it's undeniable that psychological damage can cause just as much harm as physical damage. It can cause just as much harm to someone's physical body as actually attacking someone physically. And I'm not trying to make any political statement here about, words being like weapons or anything. This is just the fact is that people who have something visible on the outside are more likely to be taken seriously than someone who doesn't.
Absolutely.
So, yeah. So,
and also I would suggest there's so many systems that are supporting everything financially. The drug companies, to change things would be huge. The drug companies, the insurance companies, the legal side of all this about disabilities and things. There's so much to change. Even the manual handling, evidence is there that actually we can lift heavier things if our back isn't straight and we don't go through and use our hips and knees, and that actually we don't have more pain. It doesn't cause pain by lifting badly. But that's going to shift so much. And even though the evidence is there and has been for decades, it's going to take a lot more than that to actually cause a shift in people's understanding. And that's just a huge topic in itself, isn't it?
Absolutely. Well, and Emily is pointing out there's less money to be made if we can cure ourselves. But you know what? I think there's a silver lining to the fact that, look, there's no doubt that the last few years have been terrible for many stabilizing forces in our societies. But I think one of the ways in which the last few years has been helpful is people are more likely to question the authority of a physician, perhaps, and say, hang on a second, is this really my only option? And I'm hopeful that means that more people will take this into their own hands and help legitimize, because really this is a grassroots activism, I guess, in the mind body world. The more people are talking about this, the more, I don't even like calling people patients, but the more people with symptoms like these stand up and say, hey, this is how these things need to be treated, the more noise we're going to make, the more likely it is that we're going to make changes.
Absolutely, and changes have occurred in all sorts of ways worldwide. So I'm sure we're getting to a tipping point. It might take more time, but slowly but surely there. I mean, compared to 15, 16 years ago, and when Dr. Sana was working on his own, it's a massive difference. So we're going in the right direction, and there's more and more evidence, which is going to help. And the more evidence we have on the dizziness side, the better. As well.
Yes. Working on that. I'm involved in a couple research projects right now, but I'm one person, so there's only
you're one person at the moment. I was the only person in the UK 16 years ago. Okay? So things will evolve. I've no doubt. I know your passion will reach out to more practitioners as well who want to work in this, and then inevitably people who want to then look at the studies as well, or start doing some studies.
Yes.
I love here. What's it? Janice said, "I'd rather be hit with the hammer."
Amen. Amen.
And Fiona says she has a lot of childhood trauma to work through. This last week, she's finally had an emotional breakthrough because she suppresses emotions. I thought I'd feel better, but I feel worse. Is that normal? Think I'm being impatient.
That is normal. Yeah. I'm sorry that you're feeling that way, but if you think about, so gosh, I'm sorry. Georgie, you probably know this about me already. I am the queen of metaphors. I love metaphors, but sometimes they're great and sometimes they're questionable. And this one is maybe a little bit in between, but let's just pretend, Fiona, that you've been doing squats, okay? Like you learned how to squat, and it turns out you've been doing them in a way that wasn't optimal your entire life. And then in comes this wonderful trainer who says, Fiona, congratulations, we're gonna get you to squat perfectly. And in order to start squatting perfectly, you're going to have to take all the weights out of your hands. You're going to only be able to do this with body weight, maybe a little bit of assistance, because your body doesn't know how to do it yet. So there's a process of relearning there that can be a little painful, that can be a little destabilizing, that can feel a little dangerous, especially for brains that are particularly sensitive to dangerous things, or particularly sensitive to the perception of danger, I should say. So it's normal and expected. So again, you can, if this helps you, you can think of it, oh, I'm just learning to squat and my body's a little sore because I'm trying to learn how to do the squat right now.
Well, that's a different metaphor. But I was wondering where we were going with that at first.
Yeah, but, that's the metaphor.
Yeah. No, but I think that's right. If you've suppressed so much all your life, or repressed, so that you're not even aware that you've been doing it, as you start to develop your felt sense, and this is where, Jim's great with really helping people build up their what's called interoception, or the felt sense, then you're going to be starting to feel more. But it's about then not necessarily thinking, well, I've got to go and explore everything from my past, but actually in this moment, how are you feeling, and learn to work through that, and learn to feel safe while you're doing that as well, and building your capacity to deal with emotions that just come and go if we let them. But if we block them, that's when we have the problems. So as soon as we start recognizing that we can safely let emotions come and go, and really build our capacity to feel safe while doing that, and be curious, then the better it is, and it'll get easier. Honestly,
it gets easier. It gets easier. Yeah.
So Emily says, I think long COVID will progress mind-body work, as it's happened to so many people. I agree. I think it will. Again, it's going to take some time, and there's a bit of an overlap there with the chronic fatigue side as well. But as long as that doesn't hold them back, then I think we should be all right. So Emily says, can stress illness be perpetuated by the stress and fear of the symptoms themselves? Absolutely. I had a happy life with little trauma. The only thing ruining it is my symptoms. Excuse me. Yeah. Sorry, I'll let you take that.
I hear that a lot. Yeah. And I completely respect your experiences. So I am not here to tell you that, well, actually, there's a trauma you don't know about and you must fix it. Of course, the fear of the symptoms themselves can be the problem. So the good news is, if that truly is the problem, it's usually a lot easier, frankly, to get better. Of course, depending on people's constitution and what else is going on in their lives, of course, those things can add some more pressure. But generally, if it's just fear of symptoms itself, then it's a simple matter of learning to relate to the symptoms differently, and accepting that this is not a sign of danger, like constant reminders of safety. The thing is, so this is where you can, Emily, this is what you can use to tell if you're right, or if there may be something else going on. Can you take in messages of safety? So when people are doing work like somatic tracking, where they're spending time with their symptoms more neutrally, or even with curiosity, with compassion, are they able to even do that? Are they able to put their hands on their hearts and say, hey, you're okay, I got you. You're safe now. When people have a hard time believing themselves, when they're like, I'm just not, I just don't believe myself when I say I'm safe, that raises questions for me about what someone's been through. And not to say that I'm right about this, and I'm certainly making no assumptions about where you've been, Emily. Again, totally, you are the expert on you. But generally speaking, when I've seen people where it's just fear of symptoms, it's relatively simple. It's a matter of exposure work, starting to graded exposure. So starting to work through your fear of symptoms by doing more and more and more, lots of messages of safety, some self-compassion, relating to the symptoms differently. It's a relatively straightforward process.
Yeah.
Yeah.
Reprogramming the brain, visualization,
yes.
all of
yes.
things. Yeah, absolutely.
Exactly. Yeah. Exactly. Yes. And I just want to say one more thing here too, that I have met many people who said, oh, I had a great childhood. And, and then it turns out I have a questionnaire I'm developing, Georgie, with a few colleagues that I hope to be able to share with you one day. We're doing some preliminary validation of the questionnaire, but it asks about more subjective experiences. So like, was anger an acceptable emotion in your house? Was physical touch a source of comfort? Did you feel like people acknowledged you? Did you feel like people celebrated your achievements? Was there someone to talk to if you were sad or in pain? Questions like that. So all people who said, oh, my parents were wonderful, I had a great childhood, I ask them questions like what I just said. And they're like, well, actually, you know, like my parents were amazing, but like no one, I couldn't be angry. Like that wasn't okay. And so then it's not trauma by any, we're not saying you're, you know, oh, you're traumatized. We're saying there's something else going on that's probably affecting how you're responding to the life stressors right now that's adding to your stress. That's what I wanted to mention.
Yeah, absolutely. Yeah, very valid. Okay, we've got quite a few questions, so I'm going to see if we can just sort of get through them before we finish.
Sure.
So Sinead says, how do you deal with the fear and possible reality that if recovery doesn't happen, you may lose a lot, your job, identity, home? I think we mentioned this earlier, didn't we? Because this leads also to an understandable urgency to get better.
This is such a great question. Oh, heart goes out to you. I get that. So obviously, I'm going to speak more generally here. And because this is such a difficult question, this is something I work through very differently depending on the individual person I'm working with. Mm-hmm. Generally speaking, I like to help people look at and deconstruct the beliefs about what some of those things mean. And not to say, of course, that people don't need an income or that people don't need a home, a roof over their heads, or don't need food. Obviously, you do need those things, but those things usually carry with them a lot more than just the basic, like, I actually need income. Again, people have, I mentioned this before, they tend to have stories around what those things mean about them that, again, kind of lead us back to some of the stressors that are things that can be modifiable. I also, another thing that I'll do sometimes, again, and please forgive me if this doesn't resonate with you, please just say, that lady was crazy. That didn't help me at all. But but this is something I do think is really helpful to people. So two different ways to go here. One is to say, okay, and what does it, if I did lose all those things, like if I did stay dizzy, if this did stay with me, what would that look like? And what am I really worried might happen? So a lot of times deconstructing the fear that way, of course, there are the like actual fears about the home, the income. But again, what people tend to miss when they're thinking about those things, when they don't ask themselves this question directly, is they miss the shame, they miss the judgment, they miss the everyone's going to hate me. I'd have to go live with my parents, and that would be just disgusting. What am I? I'm a grown woman or a grown man, and I shouldn't have to do this anymore. And again, those are not to say that it's not natural for you to have those things, but those are impulses. Those beliefs tend to be resurfaced beliefs that existed before your dizziness started. And so those are things that are a potential source to work on. The other thing that I'll do, the other direction sometimes, is when people ask me these kinds of questions, I'll flip it and I'll say something like, okay, so Georgie, you alluded to this a little bit earlier. I'll ask them a question like, okay, what would it look like if that didn't happen? So what would it look like if you did stay dizzy, if the dizziness is non-negotiable right now? Let's just say the dizziness stayed, but you didn't lose those things. What would be the first thing that would happen when you woke up tomorrow? So to kind of give people like a sense of like vision about what they can do right now to reduce the stress that they're feeling about those, again, very reasonable, understandable stressors on the outside. There are often people already have resources that they're not thinking about. And so my objective is to help get them thinking about them, to help take away some of that pressure.
Yeah. Great. What a great answer. Thanks very much.
I hope that helps. Yeah.
Okay, so on to Fiona, who, yes, you've been working with Jim, and torrents of tears this week. Oh, I empathise with that. But Yeah, it could be a can of worms, but it's, again, I often think that the can of worms is filled with a can filled with lots of different worms, and we're just taking them out. You know, you don't have to just tip them all upside down. You can take them up bit by bit. So yes, better out than in. Pippa, that's how you felt, and until you read my book and looked at trauma and stress in a different way. And now Pippa's fully recovered from 9 years of dizziness and working in this field. So
yes, she is.
You trained with you,
yes,
and living in the UK. So fabulous to have one of your team over here in the UK.
Yes. Yes.
So we're going to finish with the question from Gabrielle. But Fiona also said one thing: she's implementing learning from Jim to stop people pleasing. Yep, there's so many personality traits like that create a lot of self-induced stress, and it's just beginning to see why you do it and exploring it, and then when are you doing it, and how can you look at how you could do things differently. So Gabrielle, I have had MDDS stroke PPPD for 5 months after having a horrible reaction to a medication. It caused rocking, vertigo, and other symptoms that have stayed. I operate day to day with symptoms, but I'm stuck feeling 50% better, yet the vertigo comes back at a point once a day and doesn't stop. Why does this happen each day when symptoms are at bay in the morning?
Georgie's like, ooh,
no, it's about dizziness. I'm going to let you go with that.
Okay. Well, you know what I'm going to say. First, Gabrielle, I'm so sorry that you're going through this. It is a rough thing, and I just want you to know you're not alone with this. And deep breath. You can get better. It doesn't matter what set it off, whether it was a medication or it just spontaneously happened, as it does to some people. You can get better. At this point, what's leading to the issue is your nervous system being sensitized. So it's no longer the medication. At this point, the medication would be out of your system. So again, just have hope that this is not something that you can't recover from. So a couple things that come to mind here. When vertigo or a specific symptom tends to recur at the same time each day, I get really curious about when that's happening and what's happening around that time. So very often there's some source of stress. And when I say stress, people get very angry with me. So I'm going to qualify what I mean by stress. Stress doesn't mean, oh my gosh, I'm so stressed, it's the worst. I don't mean that at all. The stress often flies completely under the radar. It can be under the guise of a completely normal event or of a completely joyous event. Stress is an internal response to something that's happening on the outside, and it's not always obvious. So when someone has this recurring, like clockwork symptom that shows up at a specific time, typically that means either there's a stressor around that time that is triggering the sensations at that time, or that there's cumulative stress from throughout the day, and it's accumulating, and then it kind of overflows the bucket, so to speak, by that time every day, which is why a lot of people do notice symptoms worse in the evening. Not everyone, but that is why that happens. Cumulative, or there's a stress, some kind of source of stress at that time. It may be useful for some people if you're looking and you're like, there is no source of stress, I don't know what she's talking about. It is still useful to think of it as, my brain is associating this time of day with this particular sensation, and to treat it as a simple brain association that's just a mistake. And then later on, when you don't feel so bad, look back and say, okay, what else might be leading to this overflow stress response at that time?
Yeah, because sometimes in the moment when you're feeling like that, it's very hard to actually
totally
really get to the bottom of things.
Right.
But this is where quite often developing your felt sense, your interoception, can be really helpful. Because if you start really noticing how you're feeling, excuse me, you can start noticing that. We'll put it this way: we end up with symptoms because we are not acknowledging the trigger, not acknowledging the emotions that have been triggered. So the more emotional awareness you have, and the more able you are to start noticing a shift, even before you get the dizziness or it starts to increase, then you can start working on that. self-soothing, doing some emotional awareness. And this is, like I often say, if somebody has a migraine, then usually there's something that happens before the migraine, an aura or something. So great, they can begin to work on that before they then, because it's very hard to do any of this work, full-blown migraine. I know, had them. But if you can start when you have the aura, but better still, the more felt sense you have, then you can start noticing the emotional trigger and start working on the emotions so that you can avoid the aura. And then the more you can do that, you're breaking those the learned neural pathway circuits, basically, being triggered at this point, for example, at a certain time of day.
Exactly. Do you know, in a way, having it at the same time of day is an advantage because you can do this work leading up to that time. You already have a marker. Okay, this is where it's happening. Yeah. Whereas, as you said, developing a felt sense, if it comes randomly, it can be a little harder to notice it, especially if you're distracted or doing something else.
And sometimes it can be really clear. I know with one lady I worked with who had chronic pain, but she would get back pain at 4 o'clock. So what are you doing at 4 o'clock? Well, I'm starting to get dinner ready. Do you want to make dinner?
Yes.
And actually it was just a little thing like that, was just that resentment she felt every day that she had to do the dinner. Now, that wasn't the only issue, obviously, but even just changing the pattern and preparing stuff in the morning and doing something, that just changing something helped. But it might be something very subtle that you're just not aware of. And that's where learning emotional awareness and doing some self-soothing can be really helpful, to start telling your brain as soon as it knows there's something shifting that you're safe.
Totally.
Anyway, I think we need to finish now. Thank you all so much for asking all your questions, for really showing your vulnerability and being authentic. This is what we're here for. This is how we can help people. And if we're here just chatting amongst ourselves, the two of us, it wouldn't be as interesting. And we wanted it to really be able to answer some of the questions that you all have. So thank you all for your questions and for being here. It will be recorded and left on the Facebook page, and it will also be put on our YouTube channel, and no doubt you'll be sharing that as well.
Yes. Thank you all. Thank you for the warm welcome. What a fun time. I often do Q&As alone, so having you here, I mean, I was
too.
Oh, it was wonderful. I was telling Pippa earlier, because Pippa said, "Oh, I think I'll be there," and I said, "It'll be fine. Georgie will babysit me because she's going to take good care of me. I don't have to do it all by myself this time." So,
I much prefer doing it to chat about, because then we can chat, because it takes a while for the questions to come anyway.
Yeah,
but
sure.
So thank you all. Thank you for your responses as well, and thank you, Yo. I really appreciate this.
Yeah,
I love the way we
so
can collaborate together with this work.
Yes,
and
thank you.
To each other.
Thank you for having me on. Thank you, everyone.
You're welcome. All the best. Bye, everybody.
Bye, everyone.